I'm speaking with Professor Harriet Hopf, who gave this morning's Ellis Gillespie lecture. Professor Hopf, in this morning's lecture you spoke about the emerging issues in the future of anaesthesia, including personalised medicine and the environmental impact of anaesthesia. As anaesthetists, how can we protect the patient and the environment?
So I think there's a number of ways, and I think of it on many levels, that it starts with individual action, and then there's sort of action at the level of your hospital or your group. And then there's action at a more national and level, and action by maybe researchers and clinicians to develop things. So on an individual level, I think there's a lot of things you can do. I think it starts with, how do you get to work? Do you ride your bike, or do you walk, or take public transportation, or do you drive your car? I know that seems silly, but actually our anesthesiologists getting to work is a problem. And then once you get there, when you take care of your patients, you want to think about, how can I minimize the amount of waste that I'm producing? Different kinds of waste. So don't draw up drugs that you don't need, so that you don't waste the drug and you don't waste the plastic syringes. Think about the environmental impact of the drugs you're choosing. So we know total intravenous anesthesia is much lower overall carbon footprint, overall environmental footprint than the vapor anesthetics. Sometimes there might be a reason to use the vapor anesthetics. In that case, you should not use desflurane. It's very clear that's by far the worst, 100 times worse in terms of greenhouse gas production. At the hospital level, a lot of medicine today, and I think it varies by country, but in the United States for sure, we've gone more and more to disposable products where they aren't needed. So lobbying your hospital to use reusable linens, don't get disposable laryngoscopes. There's so many things that are disposable. There was a movement in the United States, oh, you have to wear this disposable hat. No reason whatsoever for that, so get yourself some really nice hats. It helps with wellness of the patient, wellness of the people, so that's a good thing. And then at the sort of national, bigger level, I think forming together in groups to encourage industry to produce new drugs, new products with an eye to sustainability. Currently there's really an effort to make everything disposable, because of course there's more profit in that, and also less risk that someone might sue you because it wasn't properly cleaned. And so really thinking about just globally the ways that anesthesia contributes to environmental impact, there's a huge variety of things that we could do to make that better.
Well, what would you say as anaesthetists is the most important things that we can be doing in our everyday practice that will have a real environmental impact?
So I think I've probably covered a lot of them, but well, when you have your tea, don't do it in a disposable cup, or maybe it's coffee, I don't know. I happen to drink tea, and I'm in Malaysia, so I feel like I should be drinking tea. And then just think about all the things that you do in your daily life. So what do I not need to draw up or open? Again, endotracheal tubes. I am in favor of those being disposable. I'd rather not have somebody else's endotracheal tube. But I see a lot of times people open them up somehow to have them ready. It doesn't take any effort to open an endotracheal tube package. And so, and once they're open, infection control says you got to throw them away. I'm kind of aligned with that. So don't open them until you're about to use them. So I think just-in-time approaches to having things. One thing that my hospital has done that's fantastic is for our emergency drugs, they draw them up under a hood so that they're good for 9 days by and large. So they're available in the cart. I don't have to draw them up. Better for patient safety, less likely to make an error, always available, and I'm not throwing away a lot at the end of the day. So I think thinking about how to be prepared for an emergency, which is really important, while not having things open that don't need to be opened. Kind of just everything you do, think about what impact is this going to have on the planet.
Definitely. Thank you very much for those tips, and thanks very much for your time today.
Thank you so much.